The organisation Gift of the Giver says its logistics division is hard at work transporting supplies from Cape Town, eThekwini and Johannesburg to its teams in the Eastern Cape. 40 hospitals in the province will now receive personal protective equipment and foodstuffs, among other things. Dr. Imtiaz Suleiman from Gift of the Givers joins us. Now, Dr. Suleiman, good afternoon to you. The last time we spoke to you here on The Pulse about the situation in the Eastern Cape, you told us so many people were hungry there. Now we know it's in the grip of a resurgence of this virus.
Yes, Stephen, good afternoon to you. It's in the grip of a huge resurgence, and it's not happening now. It's happening for the last 3 to 4 weeks. As we do for water and as we do for hunger, we await calls coming from people in the Eastern Cape. And the calls have been flooding in for the last 3 to 4 weeks. And from CEOs of hospitals, they're actually crying, they're sobbing. They're saying, you know what, we don't have PPEs, the virus. So I asked them, do you want PPEs because you think the virus is coming? Or do you have a shortage? Why do you want PPEs? They said, no, the virus is here. The numbers are rising every day. So 2 weeks ago, I went myself to the Eastern Cape and I visited many hospitals, PE, East London, Adelaide, and other areas. I saw almost 12 to 14 hospitals in a matter of 3 to 4 days. And when we got there, it was like it was scripted. Everybody said the same thing. We don't have enough staff. Our staff are getting ill. Then they asked me, can they get sick, COVID for the second time? Some of them got it the first time. They got it the second time within 2 months, and they're more ill now than before. We don't have enough beds. If we have beds, we don't have enough staff to run the beds. We need oxygen. We need PPEs. We're tired. If any staff is off or goes into quarantine, we can't manage. They said, look, they take me for a walk in the hospital. They said, look at the casualty. It's full. We need to put more chairs there. We need to bring any kind of stretchers. And then I asked, how's the hospital? How many beds have you got? Do they have COVID? They said, COVID. The whole hospital is full. I said, the COVID beds are full or all the beds are full? They just say, the hospital is full. And eventually, by further probing, they say, yes, the entire hospital is full with COVID.
It's a very stark picture that you're painting. I mean, what kind of help do people need? Obviously, as you say, PPEs, and obviously from what your teams are doing, they also need food.
Well, food is, by the way, that's not the main requirement now. What's the main requirement is staff. So we've broken it down into different types of interventions. When Nelson Mandela Bay Metro is the epicenter right now. But that's a relative issue because there's 2 million people that live in Nelson Mandela Bay. If you go to smaller areas like Andres Hospital in Somerset East, in one day they got 214 cases, and that's not a big town. If you look at Grafton, it's got 40,000 people, you've got 514 cases. So the numbers relatively in the outlying areas are climbing very, very rapidly. And there's absolute panic from the CEOs from those areas. So coming back, we're focusing on Livingston and the Nelson Mandela Bay Metro. And there, of course, because most of the cases are referred there, the same amount of staff look at increased amount of cases. And we're just busy with signing a contract with the Department of Health in the Eastern Cape province, and we're hoping that to be done by tomorrow. If that happens, on Monday, we will put 26 paramedics to support the medical staff in the Nelson Mandela Bay Metro to take the burden off the medical personnel, and we will pay for that. In Settlers Hospital in Makanda, they had a wing that was closed. Apparently, a private hospital group had the wing. They walked out, and that place was shut, and they couldn't do anything about it. We sent in a building team on Saturday. Today it's done, it's finished. We spent 750,000 rand, and that facility will be open on Monday or Tuesday for new patients. So, and in Bishu, we put up 120 beds in the hospital. Besides the 40 hospitals, we supply with PPEs and a whole lot of other stuff.
It's incredible work that you're doing, and I mean, you're in conversations with government. I would like to think that the Eastern Cape Department of Health is taking this very, very seriously. We know the Minister himself, Dr. William Kize, has been there recently. I mean, is it getting the help from government that it needs?
Stephen, there's a disconnect somewhere. I don't know what it is. I met Zweli there 2 weeks ago when I was there. We met, we didn't discuss much because he was moving from meeting to meeting. But what's puzzling me is why would a minister go to the same area 3 weeks in a row, to the same place? Is there some lack of communication? Is the information not filtering through? Is the information is getting from officials very different from the information is getting from the ground? And that's confusing. I was also told some years ago that the national minister has no jurisdiction over an MEC of a province. And that's the mandate of the Premier. So he can suggest things, but there's no guarantee it can be carried out. How far that is true, I don't know. But I was told that before by another minister. So I don't know if that is a problem or what it is. But when you go to the ground, the best place is to go to the hospital itself, speak to the staff. If one person tells you in the whole province, you know what, we got a problem, it's doubtful. But if 10 people in every hospital, in every ward tell you that, then there's something seriously going on.
Dr. Imtaz Suleiman, I really appreciate the time. Thank you very much indeed. The founder of the organisation Gift of the Givers, very stark picture being painted of the situation in the Eastern Cape.